Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. And today's Thursday, March 4th, 2021, and our weekly community update. We've talked over the last few weeks that we would move from COVID-19 and move to community update. So it is exciting to have this and not have COVID on the first screen. But so thank you for joining us today. We're going to do this each week, but it's only fitting we start with COVID. And it's still the news, and it's going to be the news for a while. There's a lot of questions and text I've got over the last few days. And we just want to talk about the numbers. Our numbers still continue to decrease. We have a few things going on in the community and surrounding communities with other things besides COVID that are causing some increases in the hospitalizations, but the COVID numbers continue to decrease. And we look at them as a percentage. You can see these are as of the 2nd, so they come down through the 2nd, which was 2 days ago on Tuesday night. Our number was 5.46 for the region as a percentage of COVID as a percentage of total staff beds in the region, but down to 5.46, and you can see it continues to be the lowest. In the Tyler area in F, it's 6.23, which is their lowest as well. And then in the Dallas region to our west at 8.04, it continues to go down. So you can see the numbers consistently go down and consistent with things we've been talking about. Here's the one that was really interesting. Yesterday was the first time that the available ICU beds that are staffed outweigh or was greater than the number of COVID patients in the ICU in our region. First time we've seen it. And I'd have to go back probably to November, maybe even October, till we've seen the red and the blue cross. But with 29 staff beds available and 20 in the ICU, it was great to see. Now, we still have increases across the area, but in that aspect, you can see for the first time that crossing. In the Tyler area to the south, the trend continues down. Have not crossed each other on available and staffed available beds and the number. But then the Dallas region, look at that, really close on getting available beds up to 200 and COVID beds down to 300. So for the first time, you can see it. So just wanted to show these numbers and talk about it. And also, if you look at the questions, and it's only fitting that I have a question that came to us during it that says, are you concerned now that Abbott has dropped the mask mandate? We wanted to talk about it today. And I want to say from Titus Regional Medical Center standpoint and in discussions with our medical staff, our clinical team, we're continuing to look at the impact of the masking policy. Now, the masking policy and the mandate that will be going away next week does not impact some other restrictions that are on healthcare institutions from the state, but we will be looking at it. We're meeting with our medical staff tomorrow to talk about it, and we've met this week and talked to a few of them. I will tell you, we are still concerned. The impacts of the last year, it was horrible. And we've talked about you're not going to turn off a switch and COVID's going to go away. COVID is real. COVID is part of our new norm going forward, but so is all infectious disease. So we are going to change more to an infectious disease concern across Northeast Texas and our community. We are going to continue to wear masks. And for the short term, as we move forward for the next few months, we'll continue to mask inside all of our healthcare facilities. We'll continue to screen, which is required by mandates. Even after the masking policy goes away, we will be required to screen. And our visitation, other things will be restricted to make sure that we're providing a safe place. So am I concerned about it? Yes, I'm concerned about it. And Terry Scoggin will continue to wear a mask. And if you see me around town when I'm inside or around people, I should have a mask on. Now, when I'm sitting at the dinner table or sitting with some friends, I may take it off. I have had both my vaccines, but not all my friends have yet. They're waiting their turn. But I will continue to wear my mask out of respect, not for just myself, but for this community. I don't want to spread something to somebody else, and going to continue to wear my mask and be a proponent of masks. I don't envision a world without masks going forward when we start talking about it. So I just wanted to bring that one up and address the governor's policy. And when we talk to our medical staff, we've got some of the best doctors around. And we'll talk more about them tomorrow, and next week I'll bring an update from them. And I hope to have a press release from Titus tomorrow or Monday after we meet with our medical staff. But it's critical for us as a team. We meet before we send out any press releases or anything. But just wanted to address it to you guys because I knew it was going to be a topic. From a vaccine perspective, we did receive 300 more first dose this week, and we're working to get those shots in arms and get those out. We're continuing to push the state of Texas for more vaccine. We're asking every week. We're sending emails every week. We're trying to trade with health systems who say, well, I've got plenty. Well, we'll take some of it as well. So we're doing everything we can to get more in this area. I do know some of the pharmacies and some of the other areas, other providers in the area will start getting some as well. So continue to watch the state's websites to see where it's available. But we're doing our best to try and get those. When we get it, we get shots in arms. So we're trying to get that vaccine out to as many people as possible. Received a lot of questions this week about Johnson & Johnson. And with the FDA approval, emergency use approval of their vaccine, it is one shot. It'll be interesting to see. I'm still doing my research. We're still talking about it as a health system. I do believe we're hearing that some places in this area we're going to get the Johnson & Johnson in next week's shipment. So it'll be interesting to see. We don't know if rural hospitals will receive Johnson & Johnson, but we're watching it closely and starting to getting more information. And we'll be meeting for medical staff tomorrow on it. But just wanted to bring that one up as far as concerns that I'm asking. Will one shot work? One question we have, can the Johnson & Johnson be done instead of the second shot of your Moderna? It's not recommended. And we'll be talking to our medical staff tomorrow, but we're starting to get that question as well. It is encouraged from Moderna to get Moderna on your second dose as well. But more on Johnson & Johnson as it comes to the area, and we'll continue to get that information out there as we receive it. And hopefully by next week, there'll be more information in the public that I can give some more specifics of the efficacy of the Johnson & Johnson vaccine. We had some great news this week. It was exciting. And on Monday or Sunday, I received a text from our friend, Dr. DeLisi, family practice physician at Titus Regional Medical Center. Dr. DeLisi's wife, as you can see in the middle, went into labor with their 14th child. And 10 of these children, you can see in the bottom right-hand corner of your screens, were delivered at Titus. And we've asked around for the last 7 or 8 months to see if anybody's had more than 10. We believe that is the record. But 10 children were born, 10 of the 14 were born here at Titus Regional Medical Center. You can see the picture at the bottom with Dr. Slovat Tucker and Dr. Mason, with Dr. DeLisi and his wife. But if you can see in the middle, Caden Matthew David DeLisi was born very, very, very early on Monday morning. I had talked to Dr. DeLisi late Sunday night as they were going into labor, but he has sent me pictures this week. He has worn the same pants in a story he sent me for all 14 deliveries. He's had the same sweatpants, and so congratulations to him to be able to do it. I can't do that. My same sweatpants from that many years ago, but Dr. DeLisi and his wife, their whole family is a great asset of not only Titus Regional Medical Center but our community. Their family is fun to work with, to volunteer with, to play with. I would encourage you not to participate in a sporting event of any kind against this family. They are notorious for winning the TRMC volleyball tournament, softball tournament, dodgeball tournament, kickball tournament. They did very well as well. But this family is ferocious when it comes to our sporting events here at Titus when we do our annual events. But it was great to see. In case you were wondering, all the boys begin with the letter C, and all the girls begin with the letter A. And it's a beautiful story, and Dr. DeLisi allowed us to share pictures and share the story with you and our community, and we'll be putting out a press release later, story about this as well to put it out there. But congratulations to the DeLisi family on the 14th edition and now 16. It's just a beautiful, beautiful pictures. It just made you smile this week with everything that was going on through COVID and through this. As we move into March, as with week 1 of March, want to give you an update on March 9th. We'll have the bladder and prostate group, the support group. Follow us on Facebook. Dr. Walsh and the team do a phenomenal job in urology service line, urology support. So please check them out on Facebook. Follow us on Facebook as well. But that bladder and prostate cancer support group, continue to follow it. As we move through and get through other things, next week we'll have more from a community update and get out, move less and less to COVID, we hope, and more exciting things. But again, on behalf of everyone part of Titus Regional Medical Center, we want to thank you, our community, for your support. God bless.